You've probably seen examples of this in the real world. Maybe this is even you. Some people are very jumpy in response to just even small changes in their environment. So if somebody's working and you walk in and you say hello and they'll go, and they're jumpy. They have a low threshold to a big anxiety or fear response. Other people are really calm. I recall my bulldog, unfortunately, he passed away. But before he passed away, if you walked in the room and you said, "Hey, Costello," he might turn his eyes in your direction. He had a very high threshold to respond. He was pretty low anxiety animal. A lot of people are like that. You come up behind someone and you say, "Hello," and they just turn around real slow, or they might just turn around at normal speed and say hello, whereas other people jump out of their seat. The insula seems to be involved in calibrating how big or how high amplitude a given physiological response is. So it's pairing the internal landscape with the external world. And this might seem like just a mechanistic but non-actionable point, but what you'll see from the next study that I'm going to describe is that recalibrating the relationship between outside events and internal responses, which is the job of the insula, is actually something that's under our control. And through a very simple, very short protocol, we can actually recalibrate that system, so much so that we can potentially reduce the amount of fear and trauma that we experience in response to a memory or to a real event, and the entire process can occur very quickly. So I'm really excited to tell you about this next study for a number of reasons. First of all, it's extremely recent. Second of all, it's very well grounded in our current understanding of the mechanisms of stress, trauma, and PTSD, and unlearning of stress, trauma, and PTSD. And third, it points to a actionable protocol that, while certainly is not the only approach that I think people could or should take for fear, trauma, and PTSD, is one that I think we are going to see implemented into the clinical setting very soon, if it's not happening already. Now, there's a fourth reason I'm very interested in it, which is that my lab works on stress relief, and tools for managing sleep and improving focus, etc. And one of the hallmarks of the studies we've been doing lately is very brief 5-minute-a-day interventions of the sort that was used in this particular study, although I should emphasize I had nothing to do with this particular study. Now, this particular study was carried out in an animal model in mice. The work in my laboratory focuses on human subjects, but the similarities of the stress system, at least at the level that it was explored in this study, I think have great relevance, maybe even direct relevance to humans. So the title of this study is Repeated Exposure with Short-Term Behavioral Stress Resolves Pre-Existing Stress-Induced Depressive-Like Behavior in Mice. Again, this study was in mice. And basically what they did is they stressed out mice, got them depressed, and you actually can do that in a mouse, using a restraint protocol. And that's a long-lasting restraint protocol of 15 minutes or more. Mice don't like it. You do it often enough, they stop working so hard in their life, in their mouse life, to gain food, to gain mates. They show depressive symptoms at a number of levels. They show elevated glucocorticoids. You see the same thing in humans. Okay, chronic stress in humans, lasting weeks or more, does the same exact thing. So again, a very close match here in terms of mechanism overall. And then what they did was a very counterintuitive thing. Rather than give these animals stress relief at the level of, reducing their anxiety with benzodiazepines, or giving them a nice little mouse vacation, or enhanced or enriched environment, things that have been done in a lot of previous studies. What they did is they subjected them to 5 minutes a day of intense stress, but only 5 minutes a day. And what they found was, miraculously, but also very convincingly, daily short bouts of intense stress actually reversed the effects of chronic stress. And it did this at the level of glucocorticoids, of hormones, of neurotransmitters, and a number of other different mechanisms. Now, I find this very exciting for a number of reasons, but in particular because my laboratory, in collaboration with David Spiegel's laboratory, our associate chair of psychiatry at Stanford, been exploring how 5-minute-a-day respiration protocols can alleviate stress. And while those data are not yet published, they are at the stage where I'm comfortable talking about them. And we are seeing some very impressive and significant effects on stress reduction, not just from respiration protocols that allow people to calm themselves, but also respiration protocols that bring people into a heightened state of autonomic sympathetic arousal, aka stress. As my colleague, Dr. David Spiegel, he's an MD, psychiatrist, and PhD, likes to say, when it comes to trauma, anxiety, and PTSD, and the treatment of trauma, anxiety, and PTSD, it's not just the state that you are in or that you go into, it's how you got there and whether or not you had anything to do with it. And this brings us right back to those top-down mechanisms and the narrative around what we are experiencing internally. So let's zoom out and I'll explain how this works and what to do about it. We have this brain structure called the insula. We talked about the insula a few minutes ago. The insula is calibrating how we feel internally versus what's going on externally. It's involved in setting whether or not what we are feeling is appropriate given what's happening. We have a system that can generate threat responses. And in the case of trauma, PTSD, and extreme stress, chronic stress, that system gets ramped up so that it takes very little, maybe even just a memory or maybe even an association that we're not even aware of, a location triggers something, we're not even aware of it, and we start experiencing that symptomology. How do we recalibrate the system? Well, most of the approaches that are out there involving drug treatments, typical drug treatments, would involve suppressing the level of internal arousal, just trying to bring that down. Now, some of those drug treatments work, but oftentimes they don't. And if you think about it, it's probably not surprising that they don't, because by taking a drug that just lowers your anxiety overall, you're creating a different sort of miscalibration of the system. So what we've been doing in human subjects is having them do either breathing protocols that calm them, and I'll explain what that is in a moment, or doing breathing protocols that increase their level of autonomic arousal and seeing how that impacts their response to stress overall, not just during that particular breathing protocol. So the calming protocol that we use involves these physiological sighs. I've talked about these previously on the podcast and elsewhere, but if you just need a reminder, if you haven't heard about it, there's a pattern of breathing that we all do in sleep when our carbon dioxide levels in our bloodstream get too high, and we do this when we get claustrophobic, meaning we do it reflexively, and that's a double inhale through the nose followed by a long exhale. So it's... And yes, the inhales should be through the nose, and yes, the exhales should be done through the mouth, ideally. So it's a big filling of the lungs through 2 breaths back to back, inhales. Even if you can only sneak in a little air on that second one, no talking if you're going to do it right, and then a long exhale, which allows you to offload a lot of carbon dioxide in the exhale. And we have people doing that in real time, anytime they experience stress, but the particular breathing protocol that we've been giving human subjects is for them to do the repeated what we call cyclic sighing. So double inhale, exhale, double inhale, exhale, double inhale, exhale, repeatedly for 5 minutes, which is actually a pretty long time to repeat that, but you can do it pretty slowly. And people report, and the data point to the fact that it's very calming. People feel more relaxed afterwards, and that relaxation wicks out into other aspects of their life. Now, we did not look at stress and trauma in that condition. We also have another condition where people do what's called cyclic hyperventilation, which is very different and creates a very different internal state and is somewhat stressful. It's 5 minutes a day of stress, much like the study that I just described. And it involves basically doing this, what I'll do in a moment, for 5 minutes, which is hyperventilating, which is but not continuously for the 5 minutes, because many people would pass out or feel extremely uncomfortable. It involves inhale, exhale, very deep, inhale through the nose, exhale through the mouth, and then every 25 or 30 breaths or so doing a full exhale and holding one's breath, lungs empty, for about 25, maybe 30, maybe even 60 seconds, and then continuing until 5 minutes is up. Subjects report, and our data indicate that people feel a heightened level of autonomic arousal. In fact, I can feel it right now, even from that very brief cyclic hyperventilation bout I just did. You feel a heating up. You feel some people will perspire. Some people get wide-eyed. Some people feel agitated. That's adrenaline being released into your system. Now, I'm not suggesting everyone run out and do this. And if you have a predisposition to panic attack or anxiety attacks, please don't do this because it is very stimulating and can trigger those sorts of attacks. But this 5-minute a day protocol of cyclic hyperventilation does lead to big increases in autonomic arousal. So it's stressful in air quotes, but to bring us back to the my colleague David Spiegel's quote, it really was him that said it, not me. It's not just about the state that you're in. It's about the state that you're in plus how you got there and whether or not you directed entry into that state. And that point of that one directs their own entry into a state deliberately is really key, and I think has an important implications for whether or not there's stress relief and fear relief and trauma relief from bringing oneself into a state of increased autonomic arousal. Why? Because of the way that fear and trauma circuitry is organized. If you recall, it's got these components of how external events can trigger an internal stress response and fear response and trauma response, but there's that top-down prefrontal component that can inhibit certain aspects of that fear and threat circuitry. Now, earlier we were talking about that prefrontal circuit being engaged through narrative, through self-directed, deliberate narrative. It's the person deliberately retelling the story. Here we're talking about a deliberate reactivation of the sensations in the body. So where I think this is all going, meaning where my laboratory and the Spiegel laboratory and other laboratories out there are taking this, is you can imagine a very brief 5 minutes a day, 2 weeks was the time that they did this, for 5 minutes a day for 2 weeks, intervention in which people, with the support of a clinician, we would hope, would deliberately induce a physiological state that's very stressful, right? Not shying away from the stress response, but increasing their own stress response deliberately, and maybe in conjunction with recounting the traumatic or fearful circumstance. This is far and away different than the kind of state of mind and body that would come about in a ketamine-assisted trauma-induced psychotherapy session or a MDMA-assisted trauma psychotherapy session or in a purely narrative-based psychotherapy session aimed at alleviating fear or trauma. The reason I like these sorts of interventions is that A, they are very low cost or even zero cost, right? You could imagine doing this while journaling or while recounting a particular experience. Again, they're very compact. 5 minutes a day for 2 weeks is what was done in this particular mouse study. We don't know if that translates directly to the human study or not. What was interesting is that if they used longer daily bouts of stress, like 15 minutes a day, that actually exacerbated the trauma and exacerbated the fear. So one has to be very careful. Stress and deliberate entry into stress and self-stressing are very potent tools. They're very sharp blades that it does appear, or it's likely, can help alleviate trauma and fear. But how long to do this, exactly what the protocol should be, is still something that needs to be cultivated. I know there are going to be people out there that nonetheless are going to want to experiment with some of this. I will say that I do not think it matters how one gets into that stressed state, provided it is self-directed, and that therefore could be cold shower. It could be ice bath. It could be anything that induces an acute, meaning a sudden onset of adrenaline, and is self-directed. That's really the key feature here. So I'm very excited about these data, both the 5-minute intervention data from the animal study, the work that's ongoing in my laboratory and Dr. Spiegel's laboratory, and the work that's being done on the insula, because I think what we're starting to see now is a picture of fear and trauma and PTSD that has this sensory component, what's happening in the world around us, this internal interoceptive component, how appropriate are the signals that are occurring in my body? I mean, let's face it, if you almost get hit by a car and your heart rate is, 140 beats per second, and that lasts for a little while and you're kind of stressed out and you don't get the best night's sleep, that's pretty normal. That means you have a healthy fear system. If that persists and you're dealing with a lot of issues a week later, 6 weeks later, 2 years later, then it's moved into the realm of trauma and PTSD. So we need to always be taking into account the different components of the circuitry. I do think that deliberate self-directed entry into these short bouts of stress is a very promising approach. And it's one that if people are going to experiment, I just again want to caution people with anxiety or panic disorders, be very cautious, probably don't do it. Ideally, you would do this in conjunction with support from a clinician. But I'm also aware that there are a lot of people out there that are dealing with trauma and dealing with post-traumatic stress of various kinds, and that they're desperate for various self-directed intervention approaches.